The mental maturity in the form of the ability to self-distance SPM, symbolic psyche, costs a lot. The bigger the SPM self-distancing, the more helpless the SPM in the face of anxiety. We should always remember that SPM is a psychotic creation which function in all people is to neutralize the anxiety. Since SPM is able to relativize its own existence and is able to accept that it's actually a fiction, then it becomes almost useless as a psychosis to overcome the anxiety. Self-distancing of SPM in the type 3 and type 2 individuals leads to the deactivation of SPM psychosis. An analogous phenomenon occurs by the people who, after a long period of not accepting the diagnosis of a mental disorder, gain the so-called insight or acceptance of the fact of having a disturbed psyche. These patients are now able to objectively describe their experiences as if they were observing themselves from the outside. This happens thanks to this SPM self-distance. Henceforth, just like the schizophrenics, a name which I use no longer, as you remember, I call them people with simultaneous polysymbolicity. So people with the disease inside so like these people with the SPM self-distance will be able to impartially observe and to treat critically any manifestation of their SPM. The type 1 people cannot do this, and that is why these people live quite often alone, despite having mastered various techniques imitating the appearance of harmonious communication. Without the ability to view the SPM as impartially as possible by the same SPM, there is no chance of a real and not fake communication with the environment. At this point, it should be noted that the type 3 people with incomplete recovery from the primary psychosis, like the type 2 people who have reached full mental maturity through SPM self-distancing, so type 3 people are not subject to the process of deepening of the SPM psychosis, as is the case with the type 1 people. It seems that type 3 people are in a way protected against the psychologically degradative sequence of the SPM psychosis by the presence of episodic psychosis and secondary somatosis. The latter, however, are degradative somatically. These psychosis and somatosis have enormous anti-anxiety potential, and when the anti-anxiety mechanisms fail, they effectively manage any even very high excess of the anxiety. On the other hand, the type 2 people with well-developed SPM self-distancing, in the case of anxiety overload and failure of anti-anxiety mechanism, cannot seek shelter from the anxiety, neither in episodic psychosis nor in the secondary somatosis, the way type 3 people can. They cannot find help in the degradation of the primary psychosis, neither, the way the type 1 people can. So what kind of anti-anxiety defense mechanism has type 2 humanity developed to solve the anxiety excess problems? Well, it may sound surprising for some people and logical for others, but the response to long-term anxiety overload will be for type 2 people also the psychosis. So the same escalation mechanism of the SPM psychosis will work here as in the type 1 people. And yet, not so long ago, I said that people who have achieved a self-distancing SPM cannot, in the case of anxiety overload, evolve towards the psychotic SPM degradation. I don't take these words back, because the psychosis that solves the problem of the anxiety overload in the Type 2 people is not the same as the degradative psychosis in the type 1 people. Namely, the psychosis that occurs in the type 2 people when the anti-anxiety mechanism fail is, as I called it earlier, negative primary psychosis, NPP, called so far as depression. Yes, I have already written and said about it in my works. True depression is also natural psychosis, and as such, it aims to neutralize anxiety. As it can be seen from the above, in the individual history of anxiety overload, the negative primary psychosis, depression, is as much a natural path in the evolution of the psyche of the type 2 people as the psychotic degradation for the type 1 people is. Both the mechanism of the negative primary psychosis and the mechanism of the psychotic degradation provide an effective response to the unbalanced anxiety. The same is true of episodic psychosis and secondary somatosis in the type 3 individuals. Summing up, we can say with absolute certainty that each of the three types of humanity has a separate mechanism for neutralizing anxiety in the case of anxiety overload, especially in the case of chronic overload, so far called anxiety disorder. Well, type 1 humanity in such a situation triggers the mechanism of transition to the new SPM psychosis always deeper than the current one, with the crowning achievement of such a psychotic succession in the form of paranoid SPM psychosis. Type 2 humanity, when its anxiolytic mechanisms are exhausted, develops the negative primary psychosis commonly known as depression, but only a small percentage of diagnosed depressions are true depressions. From now on, let's call it negative primary psychosis. Type 3 humanity finally solves the anxiety disorder with the episodic psychosis and secondary somatosis. And they are, in all three cases, the natural psyche mechanisms corresponding to each type of humanity. I expect a few questions that must have arisen at this point in your heads. I will try to guess these questions, but this I will do in the next appearance. So see you in the next lecture.